Thank you for coming to my presentation on balance. My name is Molly, and I'm a student physical therapist from the University of Michigan, Flint. Casey, as you can see here, is a physical therapist and has been my clinical instructor for the last 9 weeks. If you have any questions throughout the presentation today, please submit them in the Q&A tab, and we'll go over as many as we can at the end of the presentation. So let me ask you a question. How's your balance? Listed here are many of the topics we will be covering today during this presentation, including the definition of balance and all the factors that can affect your balance, the three body systems that help to maintain your balance, different types of balance, and how physical therapy can help. So to start, what is balance? Balance is being able to maintain your center of mass within your base of support. This means you're able to maintain a tall standing posture with your foot position being your base of support. Another way to think about balance is being in a state of equilibrium or having equal weight distribution on both feet. There are many factors that come into play when it comes to balance. We will go through each one of these in more detail in the coming slides. Both the vestibular and somatosensory systems can sound confusing, but you've probably all heard of or experienced effects from these systems. When the vestibular system is acting up, it can cause dizziness or vertigo, while the somatosensory system is the feeling of your feet on the ground. The vestibular, somatosensory, and vision systems are the three systems that work together to maintain your balance. So let's go into more detail on the vestibular system. As I just mentioned, the vestibular system comes into play when you have vertigo or dizziness. The part of the diagram circled here in red is called your inner ear. Inside the inner ear, there are little hairs or crystals which help your body to detect movement of your head in different directions. This allows for the coordination of eye movements, posture, and equilibrium. Vertigo is a diagnosis when the crystals in your inner ear are out of place, causing the feeling of the room spinning or dizziness, mostly brought on with position changes, like going from sitting to laying down. If the vestibular system is not performing like it should be, your body relies more on your vision and somatosensory systems to maintain your balance. Next, we have vision. Vision is another very important factor when it comes to maintaining your balance. If you cannot see properly, it may be hard to distinguish one step from another or prevent you from tripping on a rug or cluttering your home. Vision is the main system that allows you to orient yourself to where you are and what kinds of things are in your surroundings. Depth perception allows you to differentiate one step from another or safely walk in the community with navigating curbs or uneven sidewalks. When your vision is impaired, your body relies more on your vestibular and somatosensory systems to maintain your balance. Your somatosensory system is made up of many nerve fibers which collect data about pain, temperature, pressure, movement, textures, and objects and sends those messages to the brain, allowing it to react. For example, if you were to step on a rock, the sensory nerves in your feet would send the message to your brain that tells it that, ow, that hurts. And the body would react by lifting the foot up. Without proper feeling in your feet, you could continue to step on that rock, causing damage to the bottom of your foot. This is especially important to watch out for if you have diabetes or have been diagnosed with neuropathy, as losing sensation in your feet is common with those conditions. This system also helps to prevent falls by the brain activating different muscles to keep your feet stable on the ground. As we age, the signals are sent a little bit slower, which is why older adults are at a higher risk for falling. Without the feeling in your feet, your body relies more on your vision and vestibular systems. With your vision, vestibular, and somatosensory systems, if more than one system is impaired, your body has to rely on one system heavily to be able to maintain your balance. Strength is also a very important factor when it comes to maintaining your balance. Weakness in your core, legs, and feet can lead to difficulties with everyday activities like standing and walking. The muscles around your hips help to lift the legs up off the ground. If they are too weak or become weak while you are walking, you could trip and cause a fall. Another muscle group that helps to prevent falls is your ankle muscles. These muscles help to lift your toes up to prevent catching them on a rug or help to navigate uneven surfaces like grass or an uneven sidewalk. Overall, strengthening your core, legs, and feet can help to prevent falls. Similar to strength, the ability for your body to continue moving relies on your muscle endurance and proper blood flow to muscles to prevent fatigue. Endurance is your body's ability to continue moving for longer periods of time, like when you walk through the grocery store or across a parking lot to get to your child or grandchild's sporting event. Without proper endurance, your body can become fatigued. Fatigue is a feeling of having low energy, feeling overtired, or even like you might fall after being active. As we age, aches and pains can lead to people becoming less active, which can lead to reduced endurance. With reduced endurance comes fatigue due to your body being too tired to continue to perform the activity at hand. Maintaining flexibility throughout your body is important. Increased stiffness in your joints allows for less movement to accommodate for a changing environment. For example, if your ankle is very stiff, it will not allow your foot to adjust to an uneven surface like grass, gravel, or an uneven sidewalk, which could lead to a fall. Another example is if your upper back becomes stiff, you may start to lean forward more, which changes where your center of mass is. That can put you at risk for falling just due to leaning forward more. Medications are also very important to maintaining good health. It is important to take your medications as prescribed by your doctor and to only change the dose if your doctor says so. As we age, medications can be absorbed differently as your metabolism slows down, so it is important to talk to your doctor if you are having side effects from your medications. Some side effects can include dizziness, lightheadedness, drowsiness, poor judgment, and vision changes. So why is balance important? Maintaining or improving your balance is a great way to prevent falls and associated injuries. More than 1 in 4 adults over the age of 65 will fall each year. Falling can lead to head injuries or broken bones. It has also been proven that if you fall once, you are more than 2 times as likely to fall again. Feeling confident in your balance allows you to remain independent and active in your home and in the community. In the diagram on the bottom, it states that in 2018, there were 52 million adults over the age of 65, with 36 million reporting falls that resulted in 8 million serious injuries. But they estimate that by 2030, there will be 73 million adults over the age of 65, with 52 million falls and 12 million serious injuries. There are many types of balance, including static, dynamic, anticipatory, and reactive. Static balance is standing in one place without needing to step or hold onto a surface to maintain your balance. Dynamic balance is maintaining your balance while your body is moving, like while you're walking. Anticipatory balance occurs when you know something is going to change, like attempting to step down off of a curb or walking on the grass. Reactive balance occurs when you are not expecting something to happen and your body reacts, like if someone were to bump into you at a grocery store. It is important to challenge all types of balance to be sure your body is stable in all types of situations. Some home modifications that can help reduce falls include those listed here on the slide. As we talked about earlier, vision problems can lead to falls, so it is important to have night lights in the hallway to illuminate the space for trips to the bathroom during the night. Another important thing to install in the bathroom are grab bars next to the toilet and in the shower, and to use a non-slip mat to prevent falls. If you have stairs in your home, it is important to have handrails on both sides to assist with ascending and descending stairs in case you slip. It is important to keep walkways free of clutter and make sure throw rugs are removed from your home or tacked down to the floor to prevent tripping on them. So how can physical therapists help? Physical therapists are trained to assess for strength, balance, flexibility, and endurance deficits. If your therapist notices any of these things, they will provide you with proper exercises and stretches to help you get stronger, more stable, and improve your range of motion. Physical therapists can also treat vertigo if you are experiencing those symptoms. Physical therapists will determine the best exercise program with any deficits that you have and work with you one-on-one to improve your confidence in your body. So now it's your turn. Let's try some exercises. So I encourage everyone to stand up and find a sturdy chair or couch or your kitchen countertop to try out some of these balance exercises. It is important to have something to hold on to in case you lose your balance. If you do not feel comfortable trying these exercises with me, feel free just to listen. So if you want to start performing these exercises at home, start small and build up as you are able. So you do not need to be able to perform all these exercises in one day. Just pick a couple and start from there. And then if any of these exercises cause pain, stop performing them. That is not the point in the exercise. So as a reminder, static balance is trying to maintain one position. So let's start by putting your feet together like seen in the diagram in A. So just like this one. So you'll stand up. Oops. There we go. So feet are directly next to each other. So get in your position, holding on, and then feel free to hover your hands over top. The goal is to hold that position for about 30 seconds. If you start to feel wobbly, feel free just to touch down, regain your balance, and then start again. Typically, they're performed for 30 seconds to a minute, but for today, we'll just go through a few seconds of each one. So the next position is listed under B. So you'll put your right foot in, like right next to the big toe of, or your right heel in front of the big toe, your left big toe. Once again, hold on to get into position, and then lift your hands as you're testing out your balance to see how you do. You could also perform this exercise the opposite way, putting your left heel next to your right big toe. The next one is listed in C. This one is more challenging than the last. So you put one foot directly in front of the other one. Feel free to get into the position, then lift your fingers. If it's really hard, try to put one or two fingers down instead of your whole hand, just to have something to support yourself. And then once again, you can also perform it in the opposite direction, putting the left foot in front of the right. The last exercise is even more challenging. It's not listed on the slide, but it is standing on one foot. I would only encourage you to try this one if you felt confident with your balance in the exercise listed under C, as this one is the most challenging since you don't have both feet on the ground. So once again, get into position, hover your hands over the top, and try to maintain that position. This one you might start with a few seconds less, just because that one's pretty tough. Feel free to try it on both sides. So with these exercises, you can obviously monitor how you feel with them. And if it feels really challenging, it might be time to set up a free screening, a 15-minute free screening with Renue PT, or talk to your doctor about your balance. So with dynamic balance, that is like different things while you're walking. So you can walk kind of along your couch or down a hallway in your home, and then you'll do things while you're walking, you'll kind of turn your head side to side or up and down. Those are good ones to start with, because the head movement kind of challenges your balance since it's not staying in one position. And next, we have some strength exercises. Strength and flexibility. So the first exercise is called a long arc quad. If you can see me. Not quite. But what you do is you're sitting in your chair and you'll extend, kind of tighten the top of your muscles here and just extend your knee out. You'd hold that for about 5 seconds and then relax. Typically, strengthening exercises, you will perform 10 at a time and then do another set. Feel free to try that out on both legs. I'll give you a second to try those out. Okay. So the next exercises are to strengthen all the side, the front, and the back of your hips. So start holding on. Since this is not meant to be a balance challenge, it is meant to strengthen. So you'll start with going straight back. You keep your knees straight and just kick backwards. Try not to bend forward with it, as that's not the proper form. So stand nice and tall, even if it's just a super small movement. That's about all you need to do. And once again, you would typically perform 10 per set and then do both sides. I like to do 10 on each leg and then go back and do them each again 10 times. Another exercise is the same, but with using the front muscles. So you can stand and do like a march. I like to alternate this one back and forth, doing 10 on each leg. So you can count to 20 as you go, take a little break, and then do 20 more. The last type of exercise is out to the side. I'll turn a little bit so you guys can see a little bit better, but you stay facing forward so you can support both hands on your chair. So with this one, you'll stand nice and tall and then kick your leg out to the side. I tell my patients to think about leading with your heel to keep your toes pointed straight ahead to really target the side muscles of your hip. Also, try not to lean with the exercise, as you're using different muscles than just the ones on the side of your hip. Try out about 10 of those, and then feel free to try the other leg. The last one I have listed on there is mini squats. So with those, you'll hold on, get your feet about shoulder width apart, and then just squat down. Just a small motion. No need to go super low, as it still targets those same muscles. Sometimes I'll tell people to have a chair behind them, so they squat down to tap their butt on the chair, and then stand back up. All right, so those are all the strengthening exercises I have for you today. Next, we'll do a couple flexibility exercises. So the first one listed there is a calf stretch. It's also in the picture there. So you put your hands onto a wall or sturdy surface, put one foot back, and then you kind of lunge into the wall. Bend that leg that's in the front and keep the back leg straight. And you should feel a stretch in the back part of your leg here, also known as your calf muscles. So typically you'd hold this position for about 30 seconds, stretching, giving that muscle a chance to stretch out. You can also perform that on both sides. Switch and put the other foot in the front, kind of lunge forward into the wall, feeling that stretch in your lower leg. Another common flexibility or another stretch that's good is called a piriformis stretch. Your piriformis is located kind of through your bottom back here. And that can be tight and sometimes can cause problems trying to like bend your leg like this to put your shoes or socks on. So this exercise can be performed in many different positions. We'll start with the seated one that's listed in the middle picture there. So you sit, cross your leg over, and then just kind of pull your knee towards your opposite shoulder. So you pull it up and you should feel that stretch kind of across your bottom. Once again, you'd hold that for about 30 seconds or so, just giving that muscle a chance to stretch out. Another common way to perform a piriformis stretch is for you to lay down, like in the picture on the right there. You lay down, I don't have where to lay down, but for demonstration, you would, that same thing, cross your leg over while you're laying down, and then trying to pull that knee towards your opposite shoulder. You should feel that once again in the back of your leg there. All right, some functional exercises you can perform are sit-to-stands and just walking. Walking is very important to staying active. If you currently do not walk very much, start by walking around your home for 5 minutes. Set a timer and just kind of make loops around your house, because that can help to improve your endurance. So this week, start with 5. If that's been going good, try to do 10. Just slowly build yourself up from there. As you get more comfortable and you feel like you can do a little bit more, try to walk out to your mailbox or to the end of the driveway, as that increases your strength in your legs and your endurance. Another great exercise to perform is a sit-to-stand. It is exactly like it sounds. Find a sturdy chair and stand up and sit down 5 to 10 times to increase your strength in your legs. Start by using your hands if you need to, but try to put them on your lap or across your chest as you're able to. So it looks like this. So you can start. You can start using the arms of your chair to push yourself to come to standing and then sit back down. Another important thing with this one is to sit nice and slow, as that still strengthens your muscles. But then as you're able, you can push up from your lap, perform that sit to stand, or across your chest, as that really challenges the muscles in your legs. So these are all just a snapshot of the balance, strengthening, and flexibility exercises that can be performed, and your physical therapist will pick exercises that are customized to you. As I stated earlier, all of these exercises are just to give you an idea of things that you can work on. But if any of them cause pain or you're not comfortable performing them, please don't, as I do not want anybody to fall. So as you can see, we have many locations throughout the area to help you with your balance and strength. If any of the things I talked about today sound like you and you would like an opinion of a physical therapist, feel free to give any of our clinics a call to set up a free 15-minute screening to determine if PT is right for you. Okay, does anyone have any questions?
We did have a couple questions come in. We've got 3. So if anybody who's here with us has another question, just be sure to click that Q&A button and you can still submit it within the next couple minutes. The first one we have, somebody said that they really struggle when they're like putting on their pants and they feel some weakness in their hips. So do you have any tips on how to make that a little bit safer?
Okay, so similar to like I said earlier, I did give you quite a few hip strengthening exercises. So it is not normal for you not to be able to put your pants on comfortably or feel like you're losing your balance. So that might be an opportunity to see a physical therapist or talk to your doctor about it. But I would say to start, just when you're trying to put your pants on, maybe sit. Go ahead and sit and kind of like pull those pants over your feet and then stand up to pull them up, just to be more safe. Or if you have like a bed, you could kind of have that next to you to kind of lean onto a little bit. Just because, like, you know, trying to put your pants on in a standing position without any support can be kind of scary as your hips become weaker.
Sounds good. Thank you. One person asked, what is the best way to help my senior parents who became less active during COVID? The decrease of physical activity is noticeable.
Okay, so I talked about that one too earlier a little bit with the endurance and things like that. So as you become less active, you sit in your chair longer, you just become weaker too. If you don't do a lot of things, your muscles become weaker. So one thing you could start with, like we just went through, walking. Walking is a really good one to improve your endurance and just the functional strength you need in your legs in order to do that. Also sit to stand. One easy way to incorporate that into your day is like, oh, you know, I'm sitting at my table eating breakfast. Before you stand up, do 2 or 3. Kind of make it one more than you would, because that just kind of builds that into your day. Also, it'd be good for them to set up a screening too, just to give them a chance to get the muscles really looked at that might be the weaker ones, or that could lead to falling, just because reduced endurance can lead to falling, just because they're walking a longer distance or things like that. They might get weak and they're like, oh, well, now what am I going to do? I'm not anywhere near a chair or anything like that to be able to take a break.
That makes sense. Thank you. We did have a couple of questions about medications, and especially from people who are taking a medication that they know dizziness is a side effect. So while we know that probably can't be cured, do you have any tips to kind of help them combat that side effect?
Okay, so I know of one really common medication for blood pressure. It's called the diuretic that helps to get rid of a lot of extra fluid just to like help out your heart. But with that also comes the loss of too much fluid. So sometimes if you feel dizziness with position changes, like where if you were to sit up from bed, you start to feel kind of lightheaded, or if you sit down and stand up kind of quickly, you feel that kind of lightheaded. That can just be due to not enough water consumption or fluids throughout your day. So I would start by increasing that amount of fluid that you have. And also if you do experience those symptoms with position changes, just if you lay down, sit up, wait until those symptoms kind of go away and then continue. Try not to move too quickly, as that can make those symptoms worse.
Okay. Well, thank you, Molly. I don't have any other questions, but I do want to mention that everybody who registered for this webinar will be receiving a follow-up email where you can rewatch the webinar. Anybody who wasn't able to make it live will be able to watch it. There's also some top takeaways, and there's even a printable exercise sheet that has some of the instructions for exercises that were mentioned today. So if everybody can be on the lookout for that, but otherwise, thank you, Molly. This was wonderful, and we appreciate you doing it.
Thanks everybody for listening.
Good, thanks. Bye, everybody.